My name's Chris Barnes. I'm a lead researcher working at Liverpool John Moores University, and I'm currently working on a national challenge in Stigma Indicators pilot.
So the Stigma Indicators pilot is a 2-year project. It's taken place in a number of areas across England. In the northwest we have Liverpool, Wirral and Knowsley. In the northeast we have Newcastle, Middlesbrough and Redcar and Cleveland. And then down south we have Tower Hamlets and East Sussex. And the aim is to adapt a successful Australian intervention which was designed to develop an indicator of stigma which would allow for regular monitoring of stigmatising experience experienced by people who use services designed to support people with issues around drug and alcohol use. And in addition to that, we're also developing some interventions as well. And these are targeted at professionals, short video-based interventions, almost a virtual contact intervention, which tells some of the stories behind the clients who present to health and social care services. We're going to focus on their experiences of stigma, how it's affected them, how this leads to barriers to care and early help seeking, because we know how important that is.
So we decided to work with Leicester Film Co for the project. So we went through a competitive tendering process. Working with Leicester Film Co has been really easy. I've never done anything like this before. I didn't know how difficult it would be to make films with quite marginalised and stigmatised people. But the whole process has been, well, absolutely seamless.
So from the initial kick-off meeting and the pitch process to where we are now, working with Liverpool John Moores and the team there has been a seamless experience, to be honest with you. The emails back and forth have been constant. We've been in communication about locations, how we want to go about the filming process. The team at Liverpool John Moores have been really forthcoming in bringing in interviewees, making lists of interview questions all ahead of time. So when we arrived on set, we were ready to go. In an ambition to achieve the goals that they've set out with the project itself. I think prior to coming into this project, I may have been guilty of having preconceived notions of what drug users and alcohol users were like. And having met the people and interviewed the people over the course of the last 3 days, I've realised that none of those people have met those stereotypes. So where do those stereotypes come from? Is that from public perception? Is it from a media narrative, the things you see in popular culture on TV, things like that? I don't know, but it certainly hasn't been accurate, and that's become evidenced over the last few days. Personally for me, having met these people, you wouldn't have no idea. If you were to walk past them in the street, you just think there's a normal person on their way to work going about their business. You don't have any idea about the struggles that they have faced in the past or the struggles that they are facing now, even though they are in recovery. And some of these people, years into recovery, are still facing the stigma and having this cloud follow them around from almost like a prior life, and it's negatively affecting them, and it's something that I'd like to see change, and it's something that I feel has changed within me over the course of this project, that preconception of what a drug user or what an alcohol user is like, and the reality that it just doesn't match.